morning, everybody. Well, I have a surprise for you. This is someone who I have not known before, but he now is a big guy on the scene. And this is, of course, you will be talking with him, but Scott Ford is the new CEO of the Broward Health Foundation. Now, the Broward Health Foundation is a spectacular organization. It's just not like all the other foundations. And we're going to let Scott tell you about that. So good morning, Scott.
Good morning, Anita. It's great to be with you this morning. Delighted to be here.
I'm happy you are. And you have, of course, you've taken a position that's so valuable. It's so big. And I'm so glad that someone like you is there. So why don't you first tell us a little bit about yourself, who you are? Where did you come from? The sky or the moon or the stars?
Well, thanks, Anita. Yeah, I could go on all day about that, but my background is I'm an Iowa farm boy, and I was born and raised in the Midwest, and so I have those Midwestern roots. My family is still there, and I've got 4 grandkids now. My goodness, and all 4 of those grandkids are in the Midwest. So the Midwestern roots pull me back for sure. But I've been here in South Florida now for 5 years. Love it. Have no intention of leaving, no matter how much the grandkids are loved and appreciated. They can come visit South Florida, right?
Right.
Prior to joining Broward Health, I spent 5 years with Holy Cross Hospital right here in Fort Lauderdale, which were very good years. Prior to that, I spent 6 years working in healthcare fundraising in Illinois with a system called Advocate Healthcare, the largest system in the state of Illinois, and really had a good time there. Learned about fundraising best practices from a mature fundraising shop there, and really brought those skills and that experience down here to South Florida, and really can't wait. Really, Anita, I really can't wait to start generating friendships and financial support for this wonderful health system, Broward Health.
Well, you have the personality to do it, if anyone does. And Scott, you're a new kid on the block for Broward Health Foundation, but not a new kid on the block of fundraising for health facilities. And why don't you now tell a little bit about, if someone said to you, what do you do, Scott? And you would say,
Anita, I'd say that I represent the patients and the families that we are so privileged to serve. And we're not talking philanthropy at its heart really has nothing to do with money. It's all about the love of humankind. When you want to boil it down to its essence, philanthropy is about the love of humankind. And sometimes people choose to express their love and their gratitude through financial support. And of course, we love that, don't we? Because that helps us complete our mission. But the essence of what I do is connect people and their passions with organizational opportunity. It's really that simple, but it's tremendously profound, and I love it. I love helping people see opportunity for them to support increasing healthcare margins of excellence in the community that they live in.
Why don't we talk about what the Broward Health in general consists of, the hospitals and what they do?
Okay, so yeah, for the listeners who might not be otherwise very well informed of Broward Health as a system, geographically, we occupy the northern 2/3 of Broward County, 4 hospitals, and the Sala Foundation Children's Hospital. And the Children's Hospital is located in 2 locations: Coral Springs, Broward Health Coral Springs, and Broward Health Medical Center in downtown Fort Lauderdale. So as a system, yeah, it's very robust. I think our market share, if I'm correct, maybe 25 or 26% and growing. There's a lot of competition in this marketplace from other healthcare systems, but because of the quality and the excellence and the value that Broward Health provides to our constituents, to our community, we're able to have the great market share that we do.
Yes, I hear great testimonials when I've attended some of the meetings, not just the foundation meetings, but there are meetings at each of the hospitals. They have people from the community, and there are always stories. Oh my goodness, my father, my mother, my child went there, and it was unbelievable. And And today, if you go into the newspapers, it seems like there are always complaints about hospitals. So it's so nice to hear this.
It is. I hear all those same stories, Anita. And, you know, so a lot of what we do here in the Broward Health Foundation is respond to expressions of gratitude. And so when people spontaneously, either directly themselves or through the physician that's caring for them, want to share their story of gratitude, we follow that. We follow that wherever it leads. And it's very fulfilling work, obviously, for those of us who do it here on the ground, but also very rewarding for the people that support us and partner with us with their financial gifts and allow us to continue to grow and evolve and be cutting edge in everything that we do.
So let's talk a little bit about that. So let's say you get a phone call one day, hopefully tomorrow, and they say, gee, I have $100,000, I have $1 million, I want to contribute. What can I do with it? Where's it going to go?
Oh my goodness, yeah. You know, the sky's the limit, Anita. A lot of folks want to know what's happening in the areas of innovation, right? And what's coming next in healthcare. Or sometimes it might be as simple as, I know my doctor needs an important piece of equipment. You know, I heard my doctor say, I would like to have this equipment that would help facilitate some analysis or patient service of some kind. So there are a lot of ways that we can go. And one of the things that the foundation team and I are focusing on right now, in fact, I think you know this, Anita, this is my top priority, is to put together a robust portfolio of collateral materials that completely explain to anybody that comes to our door with that question that you just asked. If somebody says, what's going on at Broward Health that I could be interested in, that would, you know, if I'm an investor, what is the value add for me as an investor? I want to be able to have my team and I show them a whole portfolio of opportunity, whether it be programmatic opportunities to support a special service line or their individual physician, whether it be a capital project, something that's coming out of the ground, a building that's coming out of the ground, or even support for our associates. And that could be in the form of nursing scholarships or financial assistance for employees that might need it. Anything, the whole suite of opportunity is open. You know, sometimes we do, if you don't mind me adding on to that a little bit, sometimes donors, potential donors will come to us with an idea, and it'll be a great idea, something that they'll want to see, maybe a new service line or something like that. A great idea, certainly worth funding, but it might not be something that's directly within our mission or something that is easily able for us to accomplish. And if that happens, and it does happen occasionally, we will certainly work with any donor to try to find what's happening in the community that matches their needs. So when people come to us or when we engage with someone, we're really not trying to sell them anything. We're trying to partner with them on what we're doing and what we can do better and what the future vision is for Broward Health. And if their vision aligns with ours and it's something we can do, that's a moment of true beauty. And it's great. It's a win-win for everybody. But sometimes the donor wants to do something and it's better fit somewhere else. So we help them with that as well.
My guest is Scott Ford. He is the CEO of the Broward Health Foundation. I've been a member of the foundation for many years, and I'm always amazed when new things happen, just as Scott was saying, when they decided to go with the neonatal division. I mean, that was the most wonderful thing. So we had a tour, and a lot of us who don't have little babies or little kids, we don't really understand it. Why don't you share? I'm sure you felt the same way when you first were introduced to what they have done there.
You know, it's incredible. As you said, well, first of all, I want to thank you for being part of our foundation board. You've done some wonderful service for us, and I want to say thank you for that. And I'm looking forward to continuing to work with you as a board member. You know, to your point, I spent last night at Broward Health Medical Center going through our emergency operations center. I had no clue the technology and the innovation that goes into that. The emergency operations center, the electronic ICU, the attention to detail and the level of cutting edge technology that's going into the care that all of our patients across the system here at Broward Health are receiving is extraordinary. It just absolutely blew my mind last night to have that private tour of those facilities and understand that that's the best possible care that you or your family members or your friends could get anywhere in this country. You're getting it right here at Broward Health. Was an extraordinary moment. And when it comes to potential private source funding through philanthropy, I love being able to help people connect the dots, like the dots were connected for me last night. And it's whether it's neonatal intensive care, pediatrics, or what I saw yesterday with the EICU. There's so many incredible things that are happening in this health system that too many to talk about on this program today.
Well, actually, I'm glad you did start with that because, Scott, the money that people do contribute. See, we couldn't have all those special facilities or top of the line or unique or cutting edge medical appliances or areas if it weren't for donations, because it's very expensive. And actually, people who've dealt with the Broward Health system know that there are people who can't afford a lot of this, and they're certainly served anyway. And that's what's unique about, I think, the Broward Health Foundation, not the foundation, but the whole system. So I want people to understand, when you donate, this is not casual. This is something that no matter if you're 50 years old or you're 100, this is the way to be immortal, actually.
That's a great way to look at it, isn't it? You're actually paying it forward for sure. Philanthropy in all its forms is a beautiful thing, and it's certainly all around us. But yes, I think when you talk about philanthropy in a healthcare setting, you're right. There's a budget, and the budget will take care of the basic needs, funding salaries, taking care of the programs that we're privileged to provide to our community. But philanthropy itself, in addition to the budget, adds an extra level of healthcare excellence, right? It provides for extra goods and materials and services that the regular budget can't provide. Just increases that margin of healthcare excellence, allows us to do things. In some cases, there might be an identified community health needs area that is going underserved or unmet, that philanthropy can help support and provide resources toward. So, and I love talking about that. So I'm glad you brought it up. Philanthropy really does provide an increased margin of healthcare excellence, and that's probably the best way I can articulate it. Philanthropy is a value add in healthcare in a way that other areas of the giving sector really can't match.
And if people were just to have a tour, as you did, of the emergency center in Broward General, they would be amazed. See, a lot of people just don't think about hospitals like that. It's a place, maybe they had to go for some operation or they had an emergency. But if they could just walk the halls and see the dedication and understand that this is the place where life and death happens.
You're right. It's an incredible place. When most people think about hospitals, they think of it as a place they don't want to visit, right?
Right.
That's
I don't want to go to the hospital, right?
That's a natural thing. But the flip side of that is they are amazing places as well. Like we're talking about, incredible technology, incredible human caring and kindness. The acts of compassion that happen in the hospital every day on a routine basis are amazing and very, very personally uplifting to your soul, right? It's very affirming in that way to be in a healthcare setting, to see how the community is cared for on so many different levels. And I know that, here at Broward Health, striving every day to be the best place for physicians to practice, for associates to work, and most importantly, for patients and their families to heal. That's, in a nutshell, that's our mission. And I'm seeing it getting lived out every day, and so grateful to to be in this place. Like you said, if anybody ever wanted to get a taste of that, if they ever wanted to get a personal tour to see what I saw last night with the EICU or any of our programs, my staff and I would love to be able to facilitate those conversations.
Right. And it's amazing for me, the physicians who, of course, they practice, they have their own practices, but they certainly practice at the hospital also. We have some wonderful physicians on our board, and the joy that I see from them. Physicians, usually people complain, they don't seem to have joy in their life, but our, our physicians certainly do. And so that's why it's so pleasurable to go to the hospital when you have meetings there or to visit people. I'm just going to throw one thing, and it has nothing to do with philanthropy, but I love the gift shop over there at the Broward Health. And I have to tell you, I buy a lot of my gifts at the one in Imperial Point, and the volunteers, we haven't talked about volunteers yet, but that gift shop is fantastic. So I'm just going to put that plug in right now. And because that money does go, it is a not-for-profit. So all the money you spend there, rather than going to Macy's, or sorry, I don't mean to say that, but just go to the gift shop and buy your things. And then that's a good way to support the Broward Health system. Did you
Sure
been into the gift shops yet?
A couple of them, yes, and you're
Okay.
right. They're wonderful. They're wonderful places. You're right. And I'm glad you mentioned volunteers. What would a hospital, any hospital, not just Broward Health, but what would any hospital be without its volunteer corps? Volunteers are the lifeblood of what happens in a lot of hospitals. And yeah, although I don't oversee the volunteer program, I can assure you that volunteers are loved and appreciated and always needed. So if anybody is watching your program right now and has any inkling at all about where to use their time and talent, hospital volunteer programs are a really good place to do it.
I've met some of the volunteers, and some of them are in their 80s. I think there were even a few in their 90s, and they look forward to that. I mean, that's their lifeblood, and whether they carry magazines or whatever they do. So you're right. Volunteers call Broward Health. Just look it up. It's under browardhealth.org, and you'll be able to find someone to get you to the volunteer corps. But let's go back to the physicians. I know you know some of them. They are sterling, aren't they? They're very attracted because they, as you said first, there are other hospitals, there are other healthcare systems, but I know they like the Broward Health because you do have innovative systems, you have good people, you have a great foundation. How do you feel about the physicians specifically?
That's a great question, a simple question, and my answer would be a lot more complex than we have time for here. But I'll just tell you that I love them. I love working with the docs. Not to be too simplistic about it, but these people, physicians, are, like we're talking about, they're the embodiment of philanthropy, kind of in that traditional definition of philanthropy, love for humankind. Well, how could someone express their love for humankind any more than being a physician who's caring for the very life of someone that they're having that relationship with and being entrusted with their care? So physicians, by their very nature, are just really wonderful people to begin with, but they're great colleagues as well. And I've been blessed over my career to have worked with several physician philanthropy leaders who truly make the connection between the patients and the families that they're privileged to serve and those expressions of gratitude, and then bringing the foundation in as a partner, never losing the relationship with the patient, always being the primary, but bringing the foundation into that relationship with the grateful patient, grateful family. And those physicians that work with me and my team, who truly understand that for patients, expressions of gratitude, if responded to correctly, help their patients heal. Now, I'm introducing something into our conversation which could take on a whole life of its own, but there are actual studies out there, and a lot of physicians are aware of this, that the way they and their organization respond to expressions of gratitude by their patients impacts their ability to heal and improves their healing. So there's a clinical case to be made for philanthropy in a healthcare setting, and the physicians that understand that, in my experience, have been tremendous partners.
So I'm glad you brought it up that way, because that is a very important thing. Let's say you have a physician, and whether it's a he or a she, and you just like them so much, but you can't give them a check because you think they're so good. I mean, they're going to get their money from all the system, but you could, in their name, donate something, and that would make them happy. And then look what you would be doing. So let's not forget that. That's another way, and it could be $100, it could be 1,000, it could be 1,000,000. Everybody, has what they have, but please, when you're thinking about donating, do it so that it's going to something you can see. This isn't just, going to some organization that, there are a lot of wonderful organizations out there, but when you donate something specifically to Broward Health, and you can actually put your name on something. I know that they have plaques and they have a lot of things, and even though you don't have to have that, there are ways for you to say, yes, I support you. Yes, I'm part of the community. And just talk to Scott. Scott Ford is the CEO of the Broward Health Foundation. And before we run out of time, why don't you tell everybody about, it's going to be too late after people see this, but maybe next year they can go. Tell us about this great ball we're going to have.
Oh my goodness, Anita, thank you for that. Yes, tomorrow evening, Saturday, May 14th at the Hard Rock Casino and Hotel, we're hosting the 9th annual Broward Health Ball. And, from a fundraising standpoint, we're already over $500,000 raised in support. It's incredible, right? We're going to achieve higher levels than that even tomorrow night. So great fundraising and a fun time for those who are just hearing about this for the first time. Yes, we're sold out, so it's too late to join us tomorrow night. But certainly the 10th annual next year in 2023 will be an amazing event, and we'll get the word out early so people can join us. We're expecting approximately 640, maybe 650 people tomorrow night. Next year, we're going to shoot for 1,000.
Oh my!
You heard it here, right? You heard it here first.
Yeah, you're really a go-getter, and we're so happy that you were able to be on our show today. And I just wanted to go back to something. You are from the Midwest, and I know a lot of people from the Midwest, actually. And there is something very special about you. I must say that you are, it's like the heart of the country in a way. And I don't want to give you too much, ego here, but I think you bring a lot of that character to your position, Scott.
Anita, you humble me. I'm so grateful to you to say that. You just made my day.
Well,
No, really. I think, when you're talking honestly about people and their heart, where their passion is, folks are savvy. They can smell a rat from a mile away, right? But when it comes to healthcare philanthropy, like I said earlier, we're not trying to sell anybody anything. We're looking to partner with people who want to partner with us. And that brings great joy to me. So I love what I do, and I'm very blessed to be able to do it. And with leaders like you on our team, Anita, how could we go wrong? So thank you for your leadership and your words to me. I'm humbled by them, and hopefully we'll be able to live up to that standard.
And you said something, and I do want to tell everyone that even though you have a great man at the leadership, their staff at Broward Foundation, the Broward Health Foundation, is extraordinary. They work whatever it takes, they do it. And that's very important. And I know that we're going to be running out of time, but I just had to say that to them. And I know when you take a position, Scott, I'm sure you look at the staff and you say, well, are they going to be good or not? Because if they're not, they'll make or break you.
Got a great staff here. And I want to just echo your thoughts about leadership there. The new CEO of Broward Health, Shane Strum, is an incredible leader. And for anybody watching this program right now, if you want to partner with us, I would be happy and pleased to introduce you to Shane and have a conversation with Shane. so you could hear his vision for what the system is trying to achieve. An incredible leader, and I love working for Shane. I
His
know you
middle
do.
name is enthusiasm.
Yeah, no doubt about it. No doubt
Right,
about
and that's good. Well, thank you. I know you have a busy day. Scott Ford has been our guest, and he's very special. And if you need anything, give him a call. And thank you very much, Scott, for taking your time.
it. Anita, thank you so much. I've really enjoyed this conversation.
I did also. Goodbye.
Bye-bye.